Hello and welcome to this session on medication training. It's important before you carry out any medication task that you've had adequate training and you're aware of some of the basic policies and procedures. My name is Stephen Davis, I'm a registered nurse and I'll be guiding you through this session. So let's look at what you're going to learn. You're going to understand why medication training is necessary. You'll be able to realise the importance of privacy, dignity, independence, choice, safety and consent. We'll look at some of the legislation surrounding medication. You'll become familiar with the organisation's policies and procedures. You'll know your role to play with given medication. You'll be aware of boundaries when assisting, and you'll understand what you can and cannot do in relation to medication. So let's just move to the legal bit first. So what governs medication management? Well, here you can see an array of laws and policies and procedures. So we've got the Medication Act, we've got the Misuse of Drugs Act, we've got Health and Safe at Work Act, and then moving down other acts that you're familiar with, such as Controls of Substances, Hazardous Health, POSH. Throughout England and obviously the 4 countries, we've got other legislation related to Scotland and Ireland and Wales. So again, it's important you understand in different parts of the country will have different ways of working. Now, every service must have a set of policies, so a set of reasoning of why we do what we do, and a set of procedures, as in the steps in which you need to take. It's important to understand that you follow those and you understand what they are. The policies will normally talk about the types of medication, the medication aids which you can use, about over-the-counter medication. We'll look at personal protective equipment, routes to administration, and then procedures as required. So roles and responsibilities, you'll need to be aware about prescribing and dispensing. Prescribing is the person that's actually giving the instruction to the person about what medications to take, the frequency and the type. So that's normally the prescriber. Again, managers, social workers, care workers, administrators all need to be aware of the responsibilities of good prescribing. Making sure that the medication administration records are complete accurately and concisely, and again, all errors are identified and dealt with. Dispensing, and that's the person giving the medication, again, they need to understand the array of policies and procedures and can be a range of different people. It's important we understand our roles and our boundaries because there's fine lines. Carers and nurses are unable to prescribe medication unless they're trained to do so. Dispensing, unless you're trained to dispense properly, will normally be done by the chemist, and they'll be put in dosset boxes and packs. The bit which is really important is when we give the medication, so we're giving it to the person, when we're storing the medication, and then we're returning or disposing of any medication. So what can and cannot be done? So as a care worker, you're able to assist somebody to take medication, promote their independence, empower them to do this. You're able to put the medication into a cup, check it off and administer it to the person. What you're not able to do are things such as injections, controlled drugs and dispensing. So we need to understand why medication is important. We need to understand about privacy and dignity. You need to understand about storage. You need to be familiar. You need to be aware of your roles, your boundaries, and what you can and cannot do. So let's look at the service user or our customer's independence. Can we use adaptations to promote their independence? Now, there's only one person's allowed to give the medication. It will either be the service user and the family on that side or us, but we can't jointly do it because it'll get too confusing and we won't know who's done what. Maybe we've got different aids and adaptation that can help them to maintain their independence. Maybe they just need medication prompts. And overall, the responsibilities. We have different types of medications and classifications, and it's helpful for you to know some of those. So whether medication is prescribed, whether it's over the counter, whether it's a controlled drug, or whether they're homely remedies. Medications used to treat an array of conditions, and it's helpful to know some of the common conditions in which you'll be treating. If you're able to understand the medication, you'll be able to understand some of the health conditions. So for example, if they're on an antibiotic, it probably tells you that they've got an infection of some kind going on in the body. It might be a urine infection, it might be a chest infection. If they're on antihistamines, then maybe they've got allergies. If they're on laxatives, maybe they're constipated. So it's important to understand different types of medications, and you'll get familiar with those as you go on. Now let's look at the ways in which medication can enter the body. We can ingest it straight through the mouth. Topical means creams that are going on top of our skin. We can inhale them. We've got pre-rectum, pre-vagina, injections and infusions. So lots of different ways into the body. Now, when we give medication, we have what's called the 6 R's, and it's important we follow this on every single time we give medication. We need to know we're giving the right dose and the right medication to the right person at the right time via the right route. And we must remember that they have the right to decline. So how will I know? On my label, it will tell me the right dose. So it will tell me here. The right medication will be labelled at the top. The right person will have the name on it, so I need to check their identity. The timings will be morning, midday, tea time and bedtime if they're already dispensed here. Or alternatively, you may find tablets that are loose, and here you can see it'll say take 2-4 times a day as and when required, but no more than 8 in one day. The right route will tell you that it's oral, so want to be taken orally, so through the mouth. And again, we know that the customer has the right to decline. So we're going to face problems as we move on. Errors do happen and they need to be highlighted and reported immediately. We need to identify wrong medication, and we need to look at what happens if different medications received. So the MAR record, the medication administration record, says one thing, but actually you have something else. Differences whether you've got a liquid given rather than a tablet, maybe you've not had the right amount, or there's another problem. So if you have any problems with medication, you should simply stop and call the office. Preparing to give you medication involves good infection control procedures, so good hand washing, PPE, ensuring that you have the record, so it may be a paper-based record or an electronic record on your phones, the care plan, fluid to take them, and then the actual medication themselves. You will have already covered hand washing in other videos and presentations, but again, for the sake of the training, we're going to lather up our hands and we're going to go in between. We're going to do the knuckle shuffle, we go round the thumb, we palm off, and we do the wrists. So, let's start a typical medication round. We're going to get our MAR record sheet and open it up, and we can see we've got a set of instructions. We need to find the medication here, and again, it will tell us the name of the medication, the dose, the frequency, when, and the route. So all of our R's. So again, we'll check that. Once we're happy that we've found the medication, so if it's in a dosset box, so if it's already been dispensed, we're going to use what's called the non-touch technique. So again, we're going to place the tablets over the pot and we're going to pop them in. So we haven't touched those at all. And we have these pots in stock for you to use. And it's one per customer because of infection control procedures. We can place the tablet in the person's hand, we could put it on a spoon, or we can give them these tablets. We're going to observe them, take them, and give them a glass of water to wash them down. You need to watch the reflex and watch the tablet being taken. It's really important you don't take your eyes off the medication, because when you sign the MAR record chart, you are signing to say that you have dispensed and given that medication and you saw it taken. So if you're not the one administering it, you shouldn't be the one signing for it. If you've got liquids and it asks you to dispense liquids, again, same thing, we're going to read the label to make sure it matches the MAR record. So again, we would go back, we would read the label to make sure it matches. If it says 20 mils on here, and here I know it's 5 mils for a dose, then that would be 4 lots of 5, so that would be 20 mils. And on your pots, you have your measuring lines here, and you can see that 20 mils is there. Now it's important that when you're pouring liquid, you put your cup on a surface and you pour to the line. So when we do this, we're going to crouch down and we're going to pour to the line and we're going to check. Because if we hold it in our hands, we may hold it at the side and therefore not pour enough when it evens out, or maybe we're pouring too much. Again, liquid medication we give, we observe and we flush with water, because again, liquid medication can cause thrush and dry mouths. Eye drops, when we do the eye drops, again, we wash our hands, good PPE. You normally find eye drops in fridges, so some medication may be in somebody's fridge, so please check in their fridge. And again, you're going to tilt the head and move the head to the infected eye, and when you pop the drops in, you drop it so that it washes away from the face and not into the face, because you don't want this liquid going into the good eye. Eardrops, same thing, the liquids may be in the fridges. You'll check the dose on the MAR record, you'll check the label, you'll check you've got the right person, and again, you tilt the head and drop the drops in. Topical medication is, again, you'll find creams, and all creams will have the label on, and when we do the creams, we're looking for a pea-sized amount. So again, a small amount, and we rub into the effect. So you can see just that little bit of cream there does my whole entire arm. So we don't need large amounts. Medication has a thing called the therapeutic index. In other words, it's not going to work any better because you put more on. Actually, it becomes less effective. So it's important that you put the right amount on when you're putting creams on. You may have inhalers for respiratory problems, and again, these come in two kind of processes. You have blue ones for relievers, brown ones for preventers. You shake them, pop them into their mouth and squirt. Sometimes they'll have a thing which is called a spacer. It's like a tube, and it goes in the tube and they just breathe through the tube. So there's your spacer there, so you can see what those spacers look like. It's important that once we give medication, we observe for adverse reactions. Now, adverse reactions may be diarrhea, vomiting, sickness, rashes, or just generally feeling unwell. We need to be aware that they may refuse to take the medication, so it's always important to ask them beforehand, and we'll talk about that in a minute. Any errors need to be recorded and reported immediately to your office. Your MAR records look a bit like this. You'll have the name, the address, the doctor, any known allergies, their date of birth, the doctor's phone number. So if you accidentally overdose somebody or underdose somebody, you can call the GP immediately and the GP will give you advice. Most of the times it's okay and they'll say miss the next dose and not to worry. However, it's really important we get that advice because we don't want to cause any adverse reactions. When we check the stock against the levels. So again, we have the description of the stock here, the time, and the MAR record needs to be completed. If it's refused, we write an R. If they're asleep, it's normally an S. If we've destroyed, we would write a D. If they're vomiting, again, or nausea, an N, and O for anything else. So let's just look at the label. We've got the name, the amount, the dose, the type, so this is a capsule, how to store it, and again, the person and a best before date. So it's important we check all of those things. Disposal of medication is really important because each customer will have a certain amount of medication. So therefore it's important to make sure that we balance up the stock on a weekly basis. We need to assist with disposal, and again, in the incident of death of a service user, we have to keep the medication for a further 14 days afterwards. Now let's talk about consent. You all do the consent training and we're aware that every customer has the right to refuse. This is based upon levels of capacity and the fact that they're able to weigh up choice. So it's important you've done your mental capacity training and your consent training. So it's important before we give medication, before we start to dispense, to simply ask somebody and say, "Morning, Mr. Smith, I'm going to be dispensing your medication shortly. Would you like to have that now?" Because if they say no, it's going to be a lot easier for you to leave the meds and just write refuse. However, they may want certain parts of their medications. They may not want the laxatives, they may just want the pain relief. So again, you need to be able to differentiate the tablets. In most cases, if they're dispensed like this, you'll be told the colour, the shape, the mark, and the tablet description, and you'll be able to work out the tablet via those methods. So in conclusion, it's important to maintain the customer's independence at all times. You should have an understanding of the classifications of medications, so if you see a controlled drug, you should know that you can't give that for injections. We've gone through the types of medications, so again, there's medications for mental health, there's medications for physical health, and there's medications in case of emergency situations, so maybe things like insulin. Routes of the medication, we covered those, so again, ingesting, oral, eyes, ears, and topical. We've looked at risk assessments, we've done the 6 R's, and we've checked the medication. We've gone through problems if you're receiving medication in. You would ring up the office and just say that you can't find it or there's an error. Preparing the medication, we've talked about hand washing, correct PPE, and non-touch technique. You know when to dispense liquids, you do it on a flat surface. Recording, you record on the MAR record charts, you would initial your names to say that's given, or on the electronic devices, you just tap to confirm that it's been given. You need to know how the medication is stored. So are the items in the fridge or are they ambient? You should be aware about checking the stock. So again, normally you might get 4 weeks worth of these, so I've written week 1 on here. And again, I can go down and I can go, well, okay, I can see when the next dose is going to be given. And again, you should know how to dispose of the medication. Now, for us at where we operate, our policy is you put the medication into a little food bag, you write the name of it, you write the date and time, and you write for disposal, and you leave it with the pack. Then at least that way the stock ties up and we know what's happened to it. If the medication's been destroyed for whatever reason, you need to make a note of that, and again inform the office that that's what's happened, and they'll make a note normally manually for you. And again, if we do destroy the stock, it's important we don't flush it down the toilets or put it in down the drain. So it's important that it's been disposed of correctly. One other thing to talk about that they haven't covered on this training course is medication, which is called a PRN. So that's the medication that's as and when required. So what you might have is a dosset box. You might have a nomad system of NEDs, and then the doctor's then also given other medication that can be given as and when required if needed. In this instance, this customer has paracetamol. So just because they're signed up for paracetamol every 2 to 4 hours doesn't mean they need it. So it's important that I ask somebody, you have paracetamol, do you need them, and what do you need them for? To try and establish why they need them. If you do give the paracetamol, on the back of the MAR chart or on the electronic system, you'll see an area for PRNs, and you have to explain why it was administered. Now, before you're signed off for competency around your medication training, you will have to complete a short quiz, and you'll also be observed a couple of times in giving medication. You'll go out on a shadow shift and you'll observe medication being done, and then you'll have a go and you'll be signed off as competent. So if you have any concerns around medication, please obviously talk to your care coordinators or your managers. They are there to assist you and help you. Please be open, honest and transparent. If you make an error, report it. As we've said in the past, you won't get into trouble if you make an error, but you will get into trouble if you lie. Medication errors can result in people becoming significantly unwell, and they can deteriorate quite quickly. Therefore, it is important we have an open line of communication where you feel you're able to report concerns and errors. Equally, like health and safety, you'll report any near misses, so an accident that almost happened but didn't happen. The final rule of thumb is never take your eyes off the tablet. Watch them go into the mouth, watch the walk, give them the drink, watch them swallow, and don't be afraid to say to somebody, is it okay just for me to check that they've been taken? If you feel that they're hiding or storing them, just ask them to drink some more water or have a hot cup of tea with you. A couple of other things to consider as well is around concealing medication and hiding it. So we're not allowed to conceal medication or crush medication without consent of the doctor. 2 reasons. 1, we're taking away the right to choose. And 2, if we crush tablets, we don't know that we're changing the pharmacology of them. And what I mean by that is some tablets have capsules and they're slow releases, and some have sugar coatings, which means they're slow releases. So if we start crushing those, we alter the speed in which that medication enters the body, and therefore it may become less effective. So we change the pharmacology or the way that the tablet is to be given. If you're going to use inhalers and sprays and liquids, please make sure you give the customer a drink to rinse their mouth out again, because medication sitting on the tongue can cause thrush and it can be uncomfortable for them. So thanks for watching. If you need any help, please don't hesitate to contact your team.